Good evening, and welcome to the CASAA update for the week of 10/12/2015. Hi, Alex. How are you?
Good. How you doing?
I'm good. So, you just came back from a trip?
I got back yesterday afternoon,
Mm-hmm.
but yeah, I was down at VaperCon East for.
Nice.
I got down Friday evening and was there for the Saturday event.
Right. Did you have a good time?
Yeah, it's good to hang out with other CASAA people. I got to see Elaine and Brian Carter
Mm-hmm.
and Ron Ward was down there as well.
Nice.
Um, and yeah, VaporCon is it was actually, it seemed, I think there was a lot less people this year,
Huh.
which was actually kind of a good thing. It's an old school, it's one of the first Vapor events, and it's in a smaller space. So having less people around actually, I think, makes things a lot more accessible, and, it's just easier to mingle and chat with people,
Yeah.
which unfortunately I don't do very well, but other people have a much better time at these
Well,
things than I do. Um, so that's good.
that's good. So has anything interesting happened this week?
Well, there was the article that you shared. I should actually start this off by issuing a correction. I think possibly for the past few um, podcasts, and that is, I typically start off by saying, "Well, there's not much going on." The correction is that's wrong. There's always tons of stuff going on, and it may not be at the legislative level, but there are just so many other things to consider that I can't honestly say that, well, there's not a lot going on. So um, just want to officially issue that correction. Um,
Okay.
but yeah, I guess a couple of things to discuss. You had shared with me the article about Durham, North Carolina,
Yeah.
um, implementing. I was a bit confused by the article, and I honestly have not researched the ordinance that's passed.
Mm-hmm.
Um, but it sounds like the city of Durham has included vaping in their smoking ban, which the state of North Carolina has a statewide indoor smoke-free air law, and the vaping stuff is sort of catching on.
Mm-hmm. Yeah.
um, so Asheville, North Carolina, earlier this year included vaping in their smoking ordinance,
Mm-hmm.
and now Durham has done the same. And there was a difference between the city of Durham and the county of Durham.
Oh, yeah.
Um, and so it sounds like for the county,
Mm-hmm.
this is sort of an optional thing.
Right.
And this is actually one of the reasons I wanted to bring this up. And I think I'm not sure if I made this point in the Asheville call to action, but um, in the beginning, the first time I went to Asheville was in '98,
Mm-hmm.
and the city had adopted kind of an informal smoking ban in public places.
Right.
It was set up that essentially all a business had to do was post a sign saying smoking is prohibited,
Uh-huh.
and the city basically had their back, which, you know, when you think about it, that's a pretty appropriate way to do things. If you,
Mm-hmm.
as a business, want to prohibit something like smoking in your establishment, then by all means, you should have that right, and there should be
Right.
something in place, enforcement-wise, that supports your decision.
Uh-huh.
That makes perfect sense to me.
Mm-hmm.
Um, but that eventually changed, and a lot of businesses in Asheville, um, that's what they chose to do. There was a lot of smoke-free establishments in the city, and it was so much so that the places that I was going with the people that I was visiting the city
Right.
with were mostly smoke-free places. And that was one of the first times that I realized kind of the hold that cigarettes had on me.
Uh-huh.
In that, I was able to smoke throughout the day, but I wasn't able to smoke a whole lot. So
Uh-huh.
by the end of the first day, I started to feel kind of depressed, and I really couldn't figure it out until I realized, oh, it's because I haven't had a lot of cigarettes.
Mm-hmm.
Interesting. Total side note there. Um, but so that kind of sounds like what the county of Durham has in place, which is if you're a business and you want to prohibit vaping, you basically just put up a sign and the county's got your back.
Right.
Um, the city, on the other hand, has included vaping in their uh, existing smoke-free air laws, which I think that the article actually stated that that means no vaping within 100 feet of a bus stop,
Mm-hmm. Public
which
park.
is, yeah, I mean,
Yeah.
that's uh, that's pretty extreme. Um, and yeah, there was some other commentary in there about, uh, maybe it was the North Carolina indoor clean air law. I kind of clicked some of the links
Mm-hmm.
or did a little bit of research and saw that, you know, somewhere it was that, you had to be 10 feet away from an entrance, but, um, you know, what good
Yeah.
does that do? Like, I understand it with smoking cigarettes, the smell carries and it'll go right in the door. I've been in plenty of places. San Francisco is a pretty good example. It's smoke free everywhere, but um, when you're in a mission, it's pretty tight down there. So,
Uh-huh.
somebody standing on the curb outside the bar or restaurant, you open the door and it comes right in.
Mm-hmm.
So, and there's lots of other interesting smells in the mission. Um, so, uh, anyway, yeah, it's all pretty. The whole distance thing, especially with vaping, is absolutely absurd. Um, but the overall point was, in terms of North Carolina, if anybody is in North Carolina listening to this, um, I'm speculating here, but if my memory serves me correctly, the indoor smoke free air law in North Carolina started very much like this, where
Right.
businesses had that option to
Mm-hmm.
prohibit use in their establishments. And it kind of grew out of that into just being an outright prohibition of smoking in public places.
Right.
Um, and so, this is obviously a concern going forward. And, this is North Carolina. North Carolina is a very tobacco friendly state for obvious reasons.
Indeed.
Um, so, yeah, it's just this is something at the municipal level that advocates in North Carolina should be very conscious of. I would say any of the tobacco states. This is how it starts. This is how the law was amended in New Jersey. It started in Paramus,
Right.
which is that's a city in Bergen County,
Mm-hmm.
and it started there, and it made its way to the state legislature and became, the amendment happened in 2009, went into effect in 2010, and New Jersey was the first state to prohibit vaping indoors everywhere. Um, so, yeah, a lot of these things start small.
They always do, and it seems like they're hitching them to the smoke-free laws that they have, the Clean Indoor Air Acts, or outdoor as it is in this municipality.
Yeah, and it's like anything that we're discussing, um, they see the most efficient way to go about this is just to redefine tobacco to include all things nicotine.
Mm-hmm.
Excuse me.
No worries.
So that was that. The second thing to talk about, I haven't it's unfortunate that we'll probably have to go back and get the link set up for this. I need to get some more information, but back in the summer, I think we had sent out. I actually don't know if we got around to sending it out. We were kind of toying around with this.
Right.
California has ballot initiatives.
Mm-hmm.
And that's, I guess, is that where Proposition 65 came from? A ballot initiative?
Probably.
Yeah, I can't remember. So, yeah, this is kind of a way for citizens, or I guess anyone really, to, really circumventing the legislative process, but, in the event that certain things don't make their way through the legislature, citizens can bring them up, and there's a whole process to getting this on the ballot. And so all of those initiatives were released last week, I believe, and we're on there. Vaping is on there, so it's the second one down, and it is actually called. Now I gotta open stuff up.
Okay. It's not a big deal.
No,
You know far more about this than I do, so.
let's see. Did I keep it in this folder?
It's just kind of interesting how much stuff gets passed, kind of without anybody noticing.
Yeah, well, this is even more. This is more deceptive, if you can say that.
So it's kind of insidious in a way.
Well, so this is one of the points that I think that people should be making about this. First of all, you can go and comment on these initiatives. The Attorney General has posted these up, and at some point, probably this week, we will provide a link, and it's actually, if you want to look at it, you can Google California initiatives, ballot initiatives. I'll share the link with you, Jan, if you want to share this in
Sure.
The chat.
All right.
So the title of this initiative is somewhat deceptively the California Healthcare Research and Prevention Tobacco Tax Act of 2016. And the reason this is so concerning is that we have a lot of vapors out there who really don't have any problem with what's going to happen to cigarettes and other tobacco products.
Right.
But that kind of large group of people don't realize the trend of including electronic cigarettes in tobacco laws. So if you do the math, eventually all of those horrible tobacco laws will apply to vaping.
Yes.
And so that's where this becomes deceptive, because it doesn't separate electronic cigarettes from tobacco. So the concern is that when this makes it to being a petition and you have to get a certain number of signatures in order to get it on the ballot, that people who vape will look at it and say, sure, I have no problem raising taxes on tobacco. Here's my signature. In reality, what this proposal seeks to do is define tobacco to include anything that contains nicotine, except, of course, for gums and patches that have been approved by the FDA to fail, and impose a tax on them. And it's not just on the liquid, but on the devices and accessories. There's a lot of problems with this, but I would recommend anybody who wants to get an early start on this, and this actually, someone else had suggested this, credit where credit's due, she knows who she is, but one of the points to make is that the title of this act is deceptive, and it does not specifically include electronic cigarettes in the title.
Right.
And so, and this is one of the things I did a little bit of reading in that, if the initiative itself is not clear,
Right.
then it'll either need to be reworked or can just be completely thrown out. So
Mm-hmm.
this is just one point that the title of the initiative needs to be changed in order to clearly communicate to people what it's proposing to do.
Right.
So anyway, that's more a sign of things to come this week, and I'll hopefully have something
Can
fairly
I just
concrete.
make a quick, just quickly say something?
Mm-hmm.
If someone comes to you with a ballot initiative, and people are always walking around with them down here, wants you to sign it, really don't, because a lot of these people are paid per signature, and they will say anything to get you to sign them. So be sure you know what you're signing before you put your signature on it.
Yeah, and legally, I don't think the people handing out or collecting the signatures, I don't think they actually have to be straightforward with you.
They don't have to tell you the truth.
Yeah, I mean, if anything, ask them for a copy of the full text of what they're asking you to sign. Maybe at the very least they're required to carry that around.
Yeah.
But yeah, or just tell them that you're busy.
Yeah. Exactly.
But yeah, as far as I can tell, what we're looking at right now, there's a 30-day comment period. It's open until the beginning or middle of November. And so I actually do really need to get something out this week. But this is a comment period. So this is not, we're not voting here. You're not signing anything. You're not, nothing along those lines, but we are, California residents are welcome to post some sort of comment about each one of these initiatives. And we'll be asking people to comment on this one specifically. And this one will take a little bit of work. This is not something that we can do through the same system that we use for other calls to action. You're not specifically reaching out to your lawmakers. You are commenting directly on an initiative, very much like the FDA. So, we'll put together some talking points and give you some stuff, give you some pointers to get you going.
Excellent.
Yeah. So that's California, the state that never sleeps.
They love making the law there.
Yeah. What was the other? I feel like there was another policy thing, but there was one more thing I definitely that came up this weekend, and I thought that this could turn into a project for somebody. I'm not signing any of us up for it because we've got enough stuff to do. But if there are any eager beavers out there that want to do some amateur science, I had a vendor come up to our table and kind of, it's like, oh yeah, so the FDA, what's going on with that? And you start to answer, and they sort of fire back. And this guy came back with, well, I just heard it was going to be mainly about labeling, like a warning label, and then kitty stuff. And that's obviously we do what we can to clarify that and make sure that they understand that this is much larger than just some words on a bottle.
Right.
And of course, even that has its own set of consequences that could be depending on how these laws are written, that something like that could be disastrous for the state or the entire country. So but my curiosity was, and I think Brian had brought this up, was, if that's what people believe, and I think he had kind of experienced this at another convention in Texas, was, people walking up and saying, oh, well, I heard this. and they're sort of different stories that people have heard about the FDA deeming regulations.
Right.
Um, and everybody should be really clear that there have been a few different things that have happened this year.
Oh,
Um, we have the deeming regulations, which was that last year? Was that last April?
I think
Yes.
so.
Yeah. So the
Yeah.
deeming regulations were published last year,
Hmm.
and they're still going through that process of being finalized, which at some point they were at Health and Human Services. Now they go back to OMB, OIRA,
Hmm.
and then that kind of goes back and forth possibly for a little bit.
Right.
It's going to take some time. In the interim, the FDA has been conducting studies, getting soliciting information from experts and the public and whatever.
Hmm.
And we've had a couple of things come out recently. One of which was about uh, you know, uh, what would appropriate warning labels be, which we have submitted a comment on.
Right.
And now there's the most recent one that came out was drawing that distinction between, uh, you know, a, a, an over-the-counter tobacco product or nicotine product versus a medical
Okay.
device or
Yeah.
product,
Hmm.
which everybody is kind of looking at with a very fine-tooth comb, uh, because that there are some weird nuances to that.
Hmm.
Um, and so we've had a couple of other things come along, but those last two bits, those are not those. That's not the big one.
No,
That's kind of as far as I know, there's no rule that is coming out of that right now.
not
That's
yet.
sort of down the line. The deeming regulations need to be finalized before any of that would really take effect and
Hmm.
affect our access to vapor products.
Exactly.
Um, so I guess what I was getting at was I'm actually really curious about all the different things that people have heard about what the FDA is doing. And I guess you can kind of broaden that to what do they know or what do they think they know about federal legislation, state legislation, and what's going on locally.
Uh-huh.
Um, because we spend a lot of our time saying FDA deeming regs, 99.9% of vapor products will be taken off the market within 2 to 4 years,
Right.
blah, blah, blah. At some point, I think people just kind of go deaf to that.
Probably.
It's kind of like, I it's not broken record.
Well,
It's more than that.
it's. I think it's kind of like the death of a thousand cuts. After you get the first or the second or the third, you kind of become numb to it all. You know what I mean? It's so slow. The process is so slow, you can almost forget it's happening.
Yeah, so I guess at some point, our message becomes probably a little bit stale, and and we're waiting. Of course, everybody is sort of waiting for something to happen, and in the interim, in the void of anything solid coming out of the federal government, I think people's imaginations tend to run a little bit wild,
Uh-huh.
or in this case, tend to run a little tame in thinking that it's not going to be that bad.
Oh,
Um,
yeah.
so it's very important that I would recommend if anybody finds themselves in a conversation with a vendor or a consumer who is under the impression that this isn't going to affect them or isn't going to affect them all that much. I would start by referring them to our comment on the deeming regulations, um, and it's thick. It's not recreational reading,
No.
but that in and of itself should set off some alarm bells for you that this is serious business.
Yeah.
Um, but I don't know. I guess I don't know if I don't know if I want to collect some of these myths at all, or
Oh,
if,
maybe
if
maybe you could do a myths infograph.
possibly.
Well,
Yeah,
with
I guess I need
cool
to I need to
pictures.
hear them. I need to hear them and collect them first. So
Right.
if anybody listening has heard some myths or wants some things clarified, trust me, I have access to some experts here on the board and on the board of advisors at CASAA. So if anybody is interested, send me an email, a.clark at CASAA.org, and I know that Julie is going to transcribe that in the notes and laugh, an evil laugh when she does it, maybe an
Right.
empathetic laugh or a sigh. I'm not sure, but if you hear something, send it my way, and I'll see. I'm just curious, honestly, I think that's a pretty good way to engage people. Is tell me what you think you know about this, and let's see if we can clarify it for you.
Yeah.
Engaging with people is certainly a lot better than just kind of endlessly churning out information that's kind of the same over time. There was actually a study done on that. Anybody who's listening to your show is probably familiar with the drop off of the FDA campaign that they spent millions of dollars on, and they ran the first section of it, the first 6 months of it, and after like 3 months, it just everybody's bored with it, and there was really no response, but they still had millions of dollars to spend on it, something like that. So
Yeah.
anyway.
Well, and that happens with everything. And I think we have information overload, which is kind of why I suggested, like, not so much an infographic, but maybe you do such good work when you publicize the calls to action with the photos and just, I don't know. I think people tend to be more visual than word oriented sometimes. It might be an easier way to engage with people.
Yeah, I was daydreaming about an Instagram campaign to, get people informed about all of this. So maybe that's something else I'll work on. Maybe this incorporates into that. I don't know.
FDA regulation myths.
Yeah, be great.
Yeah, it'd be something. I guess that's it for this week.
Yeah. Oh, yeah. It'll segue to this. So that whole thing, that interaction with that particular vendor and others that we've encountered, really hammers home the point that everybody should be promoting the call to action to support HR 2058. Get your Congress people to co-sponsor it, and I want to see. I don't exactly know how or if it's going to work. We're in the middle of October, so it's time for me to send out another email blast to everybody. But I would particularly like to see some bipartisan interest in this bill, which I'm not holding my breath or anything like that. But hey, a boy can dream. So, so I think everybody who lives in a district represented by somebody who's not Republican should really try to convince your Democrat representative to take a closer look at this issue and get on board with us on the right side of history.
Well, it's important. It is important, and it on this one issue, it would really be nice to see some bipartisanship. I agree with you. Someone can dream.
Yeah.
So, okay. And I guess that's it for this week. So thank you for everything you do for us, Alex. And thank you to everybody who listens. We are CASAA Media on Instagram, Twitter, Google+. On Facebook, we are the We Are CASAA member group where people can chat, and the official CASAA Facebook page where people can catch links to our calls to action. If you're not already a member, please consider signing up and becoming a member of CASAA so that we can inform you when things like this are about to happen, so that you can be your own superhero and help save vaping. Thank you, Alex. Good night.
And thank you. Thanks.
Thanks.